Hello students, I am Dr. Mahalakshmi, Professor and Head for the Department of Microbiology at Sree Balaji Dental College and Hospital. I am also the Director for the Research Lab for Oral and Systemic Health. My area of interest is on oral microbiology and with a special interest on metagenomics in oral microbiome as well as gut microbiome, and I am also interested in antibiotic drug resistance. These are my area of research, and I have also been teaching the NEET aspirants at Dental Pulse franchise at Chennai. And when I was just teaching them microbiology, I found the students were struggling to prepare for parasitology. Basically in their UG, especially in case of BDS students, the parasitology is very small syllabus, small portion only they cover in UG. So they find it very difficult, but when it comes to NEET examination, they can be questioned on any area of parasitology. So they find it very difficult. So I thought let me prepare a presentation exclusively for these PG aspirants on parasitology. So today's lecture will be covering this particular topic titled Parasitology at a Glance for PG NEET Preparation. As you all know, parasitology is one of the branch in medical microbiology, and basically the medically important parasites, if you see, it can be broadly classified into two categories. One is protozoa, or otherwise referred as single-celled organisms. Another group is helminths or worms. These are the two important classes of medically important parasites. The protozoans are further classified based on the organ of locomotion or method of locomotion. So if you see the organ of locomotion, you can categorize them as Sarcomastigophora, Coeliophora and Coccidia. The Sarcomastigophora is further subdivided into amoeba, especially where the locomotion occurs due to pseudopodia. Example of amoeba are Entamoeba nagliaria, Entamoeba histolytica. And also there are flagellates in this particular group, Sarcomastigophora. In this you find intestinogenital flagellates. Some are found in the gut and some are in the genital region. So examples of intestinogenital flagellates are Giardia lamblia, which is found in the intestine. Again, Trichomonas hominis, this also is found in the intestine. And you have Trichomonas vaginalis, which is causing vaginitis. So it causes urogenital infection. The next one is hemoflagellates, where the locomotion is by the flagella. So the hemoflagellates examples are trypanosomes or leishmania. Again, this comes under protozoans. The second category of locomotion is by cilia. We can refer that as Coeliophora. The examples under this category is Balantidium coli, and this Balantidium coli is very important in the examination point of view. You can be questioned the largest protozoan. This Balantidium coli is the largest protozoan. The next comes the group Coccidia. The Coccidia are the organisms which doesn't have any organ for locomotion. They don't move and they don't have any organ of locomotion. Examples are Plasmodia, Toxoplasma and Cryptosporidium. The next category of medically important parasites are helminths. So helminths are further categorized into two classes. You have platyhelminthes and nemathelminthes. So under platyhelminthes you have Chesatoda and Trematoda. Under nemathelminthes you have Nematoda. So coming to Chesatoda completely comprises of tapeworms especially. Examples are Taenia solium, Echinococcus granulosus. Under trematodes falls the flukes, all types of flukes. One typical example of this fluke is liver fluke is Cystosoma mansoni. And under nemathelminthes you have Nematoda. Nematoda comprises completely all the roundworms. So in this slide you can just see the parasites that are likely to be found in the specimens and which are more commonly seen, which are found in India and which are not seen in India. So we will see each and every specimen what are the protozoans, because this is again important in case of this NEET examination, and what are the parasites that can be associated with these different clinical specimens. So when it comes to feces, you can encounter these parasites, especially under protozoa. You have Entamoeba can be observed, Entamoeba, Giardia, Trichomonas hominis, Balantidium, Cryptosporidium, especially the two species of Cryptosporidium, Cryptosporidium parvum, Cryptosporidium hominis. Then you have Cystoisospora belli. Formerly it is known as Isospora belli. That you must all be aware of. This is a new name given to this isospora, that is Cystoisospora belli. Now it is referred as Cystoisospora belli. Next is helminths. What helminths are observed in feces is Ascaris, Necator, Strongyloides, Trichuris, Entrobius, Taenia and Hymenolipsis. So in the blood, we will be able to observe the protozoans as well as the helminths. The protozoans, especially the plasmodium, the malarial parasites, different species of plasmodium, you can observe them in the blood. And as you all know, this malarial parasite, the definitive host of this parasite is the insect mosquito, and the intermediate host is man, and the infective forms are sporozoites. Then you can also observe leishmania in the blood samples. When it comes to helminths, Wuchereria bancrofti, which causes elephantiasis, filariasis, they can be observed in the blood, and the infective form of this Wuchereria bancrofti is third stage larva. The definitive host is just the opposite to malarial parasite. Man is the definitive host here, and the intermediate host is mosquito in case of filariasis. So when it comes to urine sample, you can observe the microfilaria of Wuchereria bancrofti, and also the ova of the flukes like Cystosomia hematobium. And this is blood fluke is the one which you observe in the urinary tract. And another important note I would like to give here is, it is a leading cause of bladder cancer. So this can also be an important MCQ question, and this can be seen in the hemorrhagic urine, where the urine contains the RBCs. This is more commonly observed in Egypt and other countries, but not seen in India. It is not seen in India. In case of sputum, clinical specimen, amoeba can be observed, but it is very rare. Then you have Strongyloides, that also is rarely observed. But in case of China, Japan, Korea and Philippines, you can see the ova of the lung fluke Paragonimus westermanni. The Paragonimus westermanni is a lung fluke which is observed in other countries but not found in India. In case of cerebrospinal fluid, free living amoeba, especially the Naegleria fowleri, that can be observed in the cerebrospinal fluid, which causes brain fever or primary amoebic meningoencephalitis it causes, and which is also referred as brain eating amoeba, and it is quite rare, but I think in 23 it is found in India. In 23 in Kozhikode in Kerala, a 5-year-old girl suffered from this. Basically she was swimming in the pool, in the pond actually, and she acquired infection from the pond. These parasites can gain entry to the brain through the olfactory nerve, through the nasal route, and to the brain it can enter, and it rarely causes, it can cause infection in a normal individual, not necessarily the individual has to be immunosuppressed. So that was the case we observed in the year 2023 in Kerala. Coming to the bone marrow, in the bone marrow you can observe leishmania and toxoplasma. In case of liver aspirates or liver biopsy, you can observe protozoans, especially entamoeba, histolytica, leishmania and toxoplasma. And also the various flukes, we refer the flukes as liver flukes, which is predominantly observed in the liver. This lives in the biliary tracts. They are fasciola hepatica, Fasciolipsis busci, Clonorchus sinensis. This Clonorchus sinensis, is other name is oriental liver fluke. This is again seen in China, Japan, Korea and Southeast Asia, but not seen in India. It is not seen in India. So in the skin, you can observe leishmania, dracunculus and entrobius. In case of muscle biopsy, trichinella can be observed, trichinella species. In duodenal aspirates, giardia can be observed and strongyloides can be observed in duodenal aspirates. So we will now discuss about the common protozoans that can cause harm to the human host. So the most notorious pathogen, if you see the protozoan in lifetime, many would have acquired this infection. There is Entamoeba histolytica, which causes amoebiasis. The protozoan, it is a protozoan, and it can also cause abscesses in the liver, lung, and occasionally in other organs. Very rarely you see them in other organs. The infective form of this parasite Entamoeba histolytica is the mature cyst. The other intestinal amoeba or Entamoeba coli, which is again a non-pathogenic, it is a commensal found in the intestine. Entamoeba gingivalis, which is a parasite of human mouth. Entamoeba hartmanni, formerly it is known as small race Entamoeba histolytica. This is also found in the intestine. And Endolimax nana, which is a commensal of large intestine. And Iodamoeba bacilli, which is again a commensal of large intestine. These are the common protozoans. So, any of these pathogens can be asked as an MCQ. Entamoeba coli, Entamoeba gingivalis, Entamoeba hartmanni, the small race of Entamoeba histolytica, Endolimax nana, and Iodamoeba bacilli. The very important feature here, you have to know about this histolytica and Entamoeba coli. Entamoeba coli is a commensal and Entamoeba histolytica is a pathogen. It causes amoebiasis. So, when any patient is suspected of having an amoebiasis, the stool is a specimen for diagnosis, and in the stool you can also see the presence of the commensal Entamoeba coli. So, how do you differentiate between Entamoeba coli and Entamoeba histolytica? So, this table shows you the different features. So, based on the size also you can differentiate. The Entamoeba histolytica is smaller than coli. It is about 20 to 30 micrometer, while Entamoeba coli is 20 to 40 micrometer. Motility, if you see, very actively motile Entamoeba histolytica, but Entamoeba coli shows a sluggish movement. In the cytoplasm, there is a clear defined ectoplasm and endoplasm, and also there will be ingested RBCs you can see in the trophozoites of these amoeba. While in Entamoeba coli, it is not well defined, the ectoplasm and endoplasm, and you do not see any bacteria inside these trophozoites, and never you will see the RBCs, basically because they are all commensals. And if you see the nucleus, again they are different. In case of Entamoeba histolytica, the nucleus is not very clearly visible, but you see the central karyosome. In case of Entamoeba coli, the nucleus is visible, but you see the karyosome as in an eccentric position, not in a central position. And if you see the cysts are the ones which are very, very important, because in case of any chronic amoebiasis, you will observe the cyst present in the stool of these patients, and you have to discriminate whether it is a cyst of coli or histolytica. Very clearly you can differentiate. In case of histolytica, the size is between 10 to 15 micrometer, and up to 4 nuclei are present, and there is also presence of chromidial bars, and these chromidial bars have a rounded end. These are the typical features of the cyst of histolytica. When it comes to E. coli, that is not, it is not E. coli, Entamoeba coli, you see the size is between 15 to 20 micrometer and 8 nuclei. So, you have to count the nuclei. So, when you count above 4, definitely it is not histolytica, it is coli. And the chromatoidal bars, usually they are irregular and they are pointed ends. The other protozoans, coming to other protozoans, the Giardia lamblia, otherwise also referred as intestinalis, it is a clear teardrop shape. Even that can be an MCQ question. What is the shape of Giardia lamblia? It has a teardrop or tennis racket shape, and it also shows a type of motility called falling leaf motility, falling leaf like motility. It has it is bilaterally symmetrical. That is another important thing with Giardia, it is bilaterally symmetrical, and the infective stage of this parasite is cyst. And it is very, very important, like how you differentiated histolytica from Entamoeba coli. Again, Giardia lamblia should be differentiated from other flagellates like Trichomonas hominis, Chilomastix meslini, both of which are non-pathogenic commensals. They are all non-pathogenic. So, very important, you have to differentiate between them. So, other protozoans, Trichomonas vaginalis, usually it has 3 to 5 flagella and has an undulating membrane. This undulating membrane only is helpful in locomotion for vaginalis, Trichomonas vaginalis, and it exists only in trophozoite stage. So, this could also be an MCQ question, which particular protozoan has only the trophozoite stage. It is Trichomonas vaginalis, does not have a cyst form here, and the mode of transmission of this is sexual transmission. The next is Leishmania, which is a flagellate protozoan. It is found in the blood and tissues. There are two types of morphological forms. One is amastigote, another one is promastigote. The amastigotes are the intracellular form, and they are actually referred as Leishman-Donovan bodies, LD bodies. What are LD bodies? LD bodies are amastigote forms. So, they are referred as Leishman-Donovan bodies, and they are usually small, round or oval bodies. Usually they are small, round or oval bodies. While promastigotes, they develop in the insect vector and in culture. Amastigotes are found in the human host, and they are very slender, motile organism. So, these amastigotes, they divide by binary fission, and this amastigotes only are taken up by the insect vector. The insect vector in India is actually sandflies. We found them in India, and it is sandflies. The generic name is phlebotomus, and these ingested amastigotes, they will come out of the cells and develop into promastigote forms in the sandfly, and once they develop into promastigotes, they migrate to the hypostome near the mouth of these insect sandflies. And there are two important species of Leishmania. One is Leishmania donovani, another one is Leishmania tropica. The Leishmania donovani causes visceral leishmaniasis. It can affect any organ, and in fact the disease name we refer it as Kala-Azar, which causes hepatosplenomegaly, anemia and skin changes. All these changes are observed by Leishmania donovani, while Leishmania tropica results in visceral leishmaniasis. So, this table just shows you different types of Leishmania and whether it is present in India and what are the reservoirs and what are the disease it produces. You see, there are so many species of Leishmania. You have Leishmania donovani complex, Leishmania donovani, Leishmania infantum, Leishmania chagasi, Leishmania major, tropica, ethiopica, mexicana complex, braziliensis complex. So many are there, but in India we observe only two types of Leishmania. One is donovani, another one is tropica, and of course the reservoirs are the humans, and the disease produced by them are visceral leishmaniasis and cutaneous leishmaniasis. The laboratory tests, the important laboratory test, how do you diagnose these Leishmania? So, mostly with the specimens we collect is bone marrow aspirate, and which is the best specimen, and in this bone marrow aspirates you can see the LD bodies. LD bodies are nothing but Leishman-Donovan bodies which are amastigote forms, and you can also cultivate them in a media called triple N medium, NNN medium, and there are two antibody mediated tests. One is formal gel test and Chopra antibody test. These two are serological tests for the diagnosis of leishmaniasis. The next one is the flagellate protozoan trypanosoma, and this flagellate protozoan, of course all of you must be knowing, it is not found in India. There are two important species. One is Trypanosoma brucei. In this brucei itself you have two subspecies, one is Gambians, another one is Rhodesians, and both of them produce sleeping sickness, which is quite common in different parts of Africa. This particular flagellated trypomastigote forms are found extracellularly in the blood, in the lymph nodes and lymph glands, and also in cerebrospinal fluids, and mainly the vector that transmits this particular disease is tsetse fly. The genus name is Glossina. This transmits the disease. And there are important other species are Trypanosoma cruzi. This produces Chagas disease, which occurs in the Brazil and other countries of South America. The insect vector for this particular disease is redwood bug, or otherwise this bug is called as kissing bug. So, this can also be asked as an MCQ, which particular vector causes this Chagas disease. It is kissing bug, while this sleeping sickness is caused by Glossina, tsetse fly. These are the two different vectors. So, these questions can be asked in the NEET examination. Coming to the next protozoan, that is Balaji coli. It causes mainly dysentery. It has both trophozoite stage and the cystic stage. As I already told you, this is the largest protozoan, the Balaji coli. In contrast to this histolytic and other amoeba, the cyst formation in case of this Balaji coli is only for protection. It is for adaptation and protection. This cyst is not for reproduction, while all other protozoans the cyst formation is for reproduction, but in Balaji coli it is only for protection, not for reproduction. The primary reservoirs of this particular protozoan is pigs. Coming to the complications of the malarial parasite. Of course, you all know there are different species of Plasmodium causing malaria. The quite a common species which is caused in India is vivax, and the other one is falciparum. So, usually the vivax infection we need not bother or we need not worry. Mostly it responds to the therapy, but the most important risk is due to this Plasmodium falciparum, and which causes malignant tertian malaria. The complications of this parasite are black water fever. What is black water fever? It is nothing but intravascular hemolysis and hemoglobinuria, the presence of blood in the urine. And other complication of this is pernicious malaria. So, in the pernicious malaria, there are three types. One is cerebral malaria, another one is algid malaria, another one is septicemic malaria. So, in case of cerebral malaria, the brain is involved. In case of algid malaria, the blood vessels, especially there is a collapse of the peripheral vessels, vascular collapse, accompanied usually by vomiting, diarrhea, and passage of blood in the feces. In case of septicemic malaria, unremitting high fever is observed in septicemic malaria. These are important complications of falciparum. The next one, the other species of Plasmodium are ovale, Plasmodium ovale, which causes tertian malaria, and also Plasmodium malariae that causes quartan malaria. Both these species are not seen in India. Ovale, the most common one is vivax, next comes your falciparum. This ovale and malaria is not seen in India, and the most important one is the vivax. And the newest species which has been identified which causes malaria is Plasmodium knowlesi, but not much seen in India, and Plasmodium cynomolgi. Plasmodium knowlesi is the fifth species causing human malaria, and Plasmodium cynomolgi is the sixth species causing human malaria. So, they can even ask the new species name in this NEET exam. The next is Toxoplasma gondii, which is worldwide in distribution, and the definitive host for this Toxoplasma gondii is our cats. The intermediate host are several different animals are intermediate host, and humans will acquire the infection with the oocyst which is shed in the feces of this cat or improperly cooked meat of the intermediate host or any other animals. And there is also very important note about this pathogen is it can be transmitted transplacentally from the mother to the fetus. So, transplacental transmission is seen in humans, and they are obligate intracellular parasites. There are usually two forms, one is trophozoite forms. They are actually called as tachyzoids, which are crescent shaped, which is observed in the acute infection, acute phase of the infection. While in the chronic infection, you see the cyst, and this cyst are actually referred as bradyzoids. In congenital infections, the child may get infected and the damage is seen to the eye and may also spread to the head, especially the hydrocephalus, the head swells, and this is a very important pathogen which is screened in the torch panel, especially the pathogens that could be transmitted congenitally from the mother to the fetus. One of the important pathogen is this Toxoplasma gondii. So, the other protozoans are Cryptosporidium. Again, this is a coccidian parasites which are worldwide in distribution. Hope you all must be knowing this Cryptosporidium was first identified as an opportunistic pathogen after the invention of HIV. It is seen in immunocompromised adult and also in children with diarrhea. You observe this. So, how do you diagnose this Cryptosporidium? So, it is mainly diagnosed by acid fast staining, saffron in methylene blue, methenamine silver stain, PASS method, and the cysts are visible by Sheether's sucrose flotation. It is a concentration method. This sucrose flotation method is a concentration method, and you can very well observe the cyst of this Cryptosporidium by this method. The other protozoans are Isospora belli. Actually, it is a very important one which you also see in AIDS patients stool, which is now referred as Cystoisospora belli. You will observe these cysts as oval shaped oocyst which is seen in immunocompromised host. The next one is Pneumocystis carinii. Again, this Pneumocystis carinii was first observed in a HIV patient. Basically, this is a common sore which is found in the environment, does not cause any disease, but it is observed to cause pneumocystis pneumonia in case of immunocompromised patients. This was first observed in United States. This Pneumocystis carinii is a coccidian parasite. It exists in trophozoite as well as cyst forms, and it is seen in the alveolar spaces of the lung tissue. You can observe them by GIMSA staining, and this causes lower respiratory tract infection in immunocompromised host, which results in interstitial pneumonia. And the specimen for this diagnosis, you can never see them in sputum. Sputum is not accepted, in fact, for diagnosing this parasite. So, this also can be an important MCQ. You have to take only a lung biopsy or a bronchial lavage or washings. Only in that you can observe this pneumocystis carinii, which causes pneumonia in HIV patients, especially in developed countries. The patients die, HIV patients die due to pneumonia due to this pneumocystis carinii pathogen. The next is Naegleria. Naegleria is a free living amoeba. It causes acute, usually fatal meningoencephalitis. It can even attack a healthy person, not necessarily immunocompromised, and the organism enters mainly through the nasal route, and usually the infection is acquired while the hosts go for a swimming or bathing in stagnant freshwater lakes or pools, and they enter through the olfactory nerves, reaches the central nervous system, and they are amoeboflagellates, and they exist as cysts, and they also exist as a flagellate trophozoite, and they are motile elongate amoeba, but you can never see any RBCs in these infected cerebrospinal fluid. They will see them without RBCs. And the next one is acanth amoeba. They are pathogenic free living amoeba, and they also can cause meningoencephalitis, keratitis of the eye. Amoeba seen as slow moving with spiky projections. So, this is a typical locomotion of acanth amoeba. We will now discuss about helminths, the chesatode parasites. The one is Taenia saginata, which is referred as beef tapeworm. This is the longest worm. It measures up to 30 meters. The definitive host for this parasite is human. The intermediate host is the cattle. The infective form of this parasite is Cysticercus bovis. So, any of these information can be asked as an MCQ. The longest tapeworm is beef tapeworm, Taenia saginata. The next is Taenia solium, which is referred as pork tapeworm. It measures up to 2 to 3 meters. The definitive host is human, and the intermediate host is pigs. The infective form are Cysticercus cellulosae. The next is Echinococcus granulosus, which is referred as dog tapeworm. This is about 3 to 9 millimeter in length, and this is the smallest tapeworm. Of all the tapeworms, this is the smallest tapeworm. The next intermediate host of this particular worm are human, sheep, goat, and cattle, while definitive hosts are dogs. The larval stage of this parasite is hydatid cyst. This hydatid cyst are the infective forms, and the diagnostic skin test is Cassoni's skin test. The positive reaction of this skin test is about, you will observe a wheal of 2.5 centimeter in diameter. This will be observed within 30 minutes. This is how this hydatid disease is diagnosed. Next is Hymolepsis nana, which is referred as a dwarf tapeworm. So, please know about these names, because this can also be asked as an MCQ question. Hymolepsis nana is referred as dwarf tapeworm because it is very short. Only human tapeworm which does not require an intermediate host. So, it does not have an intermediate host, and its life cycle usually it is referred as a dwarf tapeworm, and its life size is 2 to 4 centimeter in length, its size. The eggs are elliptical or oval, colorless, and they are infective. The eggs of these Hymolepsis larvae are elliptical in shape. The next is Hymolepsis diminuta. Actually, this is referred as rat tapeworm, and the common parasites of these rats and mice, they are the common parasites, and the larval forms are the cysticercoids, and this can develop in the insects, and the adult worm will usually develop in the humans by taking up these insects, who will accidentally swallow these infected insects, and you can diagnose these in the eggs, especially in the feces, presence of these eggs in the feces. The next one is Diphyllidium caninum. Again, this is worldwide in distribution. The definitive host is dog. Usually cat also can be a definitive host. The adult worms, they reside in the intestine of these animals, and the intermediate host is a flea, and this flea will take up the eggs of these parasites, and the cysticercoid develops in these flea, and usually the dogs will swallow these fleas, and this is how it acquires the infection, and occasionally you can see this infection occurring in human or in children. The next one is Diphyllobothrium latum, which is again referred as fish tapeworm. So each tapeworms are given a unique name. This is referred as a fish tapeworm. It measures about 10 meters and it is not seen in India. This tapeworm is not seen in India. The scolex, the head, is spoon shaped. Again, this once they have asked as an MCQ question, the spoon shaped scolex is seen in which tapeworm? It is Diphyllobothrium latum. It has 2 long grooves and doesn't have suckers for attachment to the intestinal mucosa, and the eggs are operculated in the sense on the top there will be an opening, okay, and it has 3 larval stages. You have first stage which is referred as intermediate larva, which usually is seen in cyclops, which is seen in the sea. The second one is the second intermediate larva is seen in freshwater fish. The third stage larva, that is the third intermediate larva, is seen in large fish. So these are the intermediate hosts for this larval forms of Diphyllobothrium latum. The first one is in cyclops, the second was in freshwater fish, the third one is in larger fish. Now we will discuss about trematodes or flukes. So the most important fluke is Fasciola hepatica. Again, it is not seen in India. The next one is Fasciola busci. This lives in the intestine of the pigs and occasionally you can see them also present in humans. The next one is Clonorchis sinensis, which lives in the biliary tract of humans, dogs and cats, and it is not found in India. The next one is Paragonimus westermanni. Again, this is not found in India. And the adult form of this particular parasite is seen in the lungs of the human host. Again, they have operculated eggs and they are seen in the sputum, and the first intermediate larval stage is seen in the snails and the second intermediate larval stage is seen in the crabs or crayfish. And usually the humans will acquire infection when they eat these shellfish which are not properly cooked, which will contain the metacercaria, that is the infective form of this parasite, and they penetrate the intestinal wall and they can migrate to the liver, then penetrate the liver, enter through the diaphragm to the lung, and there will be chronic cough seen in these infected persons. And you can even see some of these patients are misdiagnosed for tuberculosis. Actually, the actual infection may be due to Paragonimus westermanni, but they may show typical symptoms of TB. The next is Schistosoma hematobium. It's a blood fluke seen in countries like West Asia, Egypt, in Africa, Central Africa, and it is not usually observed in India. The sexes are separate. The body of the male worm, this is an important feature here. The body of the male worm has a very long groove called gynecophoric canal. So in this gynecophoric canal, the female worm is present. They are enfolded in this groove. The adult worm usually lives in the venous plexus and small venules where the females will lay the eggs in this venous plexus around the bladder, prostate and the uterus. And the eggs will have a terminal spine. In this will help them to penetrate the urinary bladder, and that is the reason you see these persons affected with Schistosoma hematobium. They have hematuria. Hematuria is nothing but passage of blood in the urine, and you can observe these ova in the urine sediment. The next is Schistosoma mansoni. It's a blood fluke found in Africa, South America, and also in some islands of West Indies. The adult worms live in the venous plexus in the mesentery near the lower colon, and the diagnosis is mainly made by finding the ova in the feces of the infected person. The next one is Schistosoma japonicum. It is mainly found in Japan, Korea, China and Philippines, and this liver fluke is exactly similar to that of Schistosoma mansoni. Now coming to nematodes. The nematodes harbor the roundworms especially. So one of the important roundworm is Ascaris lumbricoides, which you see in India, and which is the largest nematode worm, and man is the only host because partial life cycle takes place in the soil and part of the life cycle in man. So man is the one and only host, no intermediate host here. Just imagine the infection caused by these worms. The female, matured female lays daily 2 lakh eggs per day. So imagine in a severe infestation how the adults will or a child will be affected by this. Sometimes they may even go for a sudden surgery, immediate surgery to remove these worms. Intestinal obstruction will be seen by these worms, duodenal obstruction. The next is hookworm. The two main important species of hookworms are Necator americanus and Ankylostoma duodenal. The Ankylostoma duodenal is one of the root cause for anemia in our country, hookworm anemia. And both are found in India. You find Necator americanus as well as Ankyloma. Ankyloma is more common. The next is Trichuris trichura, which is referred as whipworm because the typical shape of a whip, this worm, has Trichuris trichura. There is again no intermediate host. Man is the only definitive host for this parasite. The egg of this Trichuris trichura is barrel shaped. Again, it can be an MCQ question. Which egg is barrel shaped? It is Trichuris trichura. Next is Entrobius vermicularis, which is also referred as threadworm or pinworms. Entrobius vermicularis. Again, in the lifetime, every individual would have been affected with this particular. It's quite common, very common parasite. The eggs of this parasite are plano-convex in shape, and mainly for diagnosis we use NIH swab for diagnosis of these eggs of this pinworm. The next is Strongyloides stercolaris. This worm represents a transition between free living nematodes of the soil and parasitic nematodes of human beings. The eggs of these parasite resemble a large hookworm shaped ova, which is referred as rhabditiform larva and filariform larva, representing both. In immunocompromised, it is fatal. The larva found in them in most of the tissues and in serous cavities of these immunocompromised patients. And the infective form of this particular roundworm, that is Ascaris lumbricoides, is this rhabditiform larva, while the infective form of this hookworm is filariform larva. The important other nematodes are Wuchereria bancrofti, which is mainly transmitted through the mosquito, which causes elephantiasis. The main mosquito which transmits this disease is Culex fatigans in our country, but other mosquitoes like Aedes aegypti and Anopheles also can be vectors of this particular parasite, Wuchereria bancrofti. It's a nematode parasite. The next one is Brugia malay. This also resembles that of Wuchereria bancrofti, but mainly it is seen in Malaysia. The other filarial worms are Onchocerca volvulus, which are mainly infected by biting flies, which is referred as Simulium. The flies are referred as Simulium. Mainly this infects this parasite Onchocerca volvulus, and this is one of the reasons for onchocercosis. It may mainly involve the infection in the eye. It can invade the cornea, sometimes causes blindness. So this could be another important MCQ, the parasite or filarial worm that which can lead to blindness. It is this Onchocerca volvulus. Next is lower loba. Again, it is seen in the conjunctiva of the eye. The intermediate host of this particular parasite is Chrysops flies, which is also which results in fugitive swellings or calabar swellings. This lower loba, this is one type of parasite which also infects the conjunctiva of the eye. The next is Dracunculus medinensis. Of course, everybody knows the history behind this particular parasite. Dracunculus medinensis is guinea worm. The intermediate host is the cyclops, which produces a painful ulcer that is produced by the gravid female worm in the skin, and these female worms, they will come out of this skin, and you can even these worms are most commonly seen in African countries, and to remove this they used to insert a needle where these worms come out, and this worms usually they twine around this needle, and this is in history we always say the medical symbol has been derived from this particular Dracunculus medinensis. Especially when you want to remove this worm, you insert a needle, and this is how these worms will twine around this particular needle. And usually you can diagnose these adults, especially when they are protruding out through the ulcers, skin ulcers. The other filary worms are Trichinella spiralis. The infections are obtained through the cooked muscles of the pigs and other animals. And you can observe these trichinella species in the muscle biopsy. So, with this I come to the end of this particular lecture, and to sum up, you had to know about the protozoans. What are the protozoans? You have entamoeba species, Celiophora species like Balantidium coli, and also you have hemoflagellates. Then in helminths you have tapeworms and roundworms and other parasites causing infection. And you have any other doubts, you can reach out to us. Thank you.